Hi everyone, I'm Dr. John Torres, Senior Medical Correspondent for NBC News. And today at NBCU Academy, I'm going to talk about reporting on HIV and AIDS. It can be a tricky topic, so let me give you some tips. First, let's start with the basics. HIV stands for Human Immunodeficiency Virus, and it's a virus that attacks the body's immune system. If HIV is not treated, it can lead to acquired immune deficiency syndrome, or AIDS. So it's extremely important to understand the difference between HIV, the virus, and AIDS, the syndrome caused by the virus. Accurate reporting on this topic requires that you do not conflate the two. For example, you should avoid the term HIV/AIDS or HIV/AIDS whenever possible because they are not interchangeable. Everyone who has AIDS has HIV, but not everyone with HIV develops AIDS. Now that being said, let's go over some of the key terms you'll be using in your reporting. First, a person living with HIV is just that, a person living with HIV. So avoid using terms like victim or patient. Remember, people living with HIV are people first, and many are healthy and thriving. Furthermore, a person is infected with HIV. They are not contaminated with HIV. An inanimate object, like a used syringe, may be contaminated with HIV, but not a person. So never use the word contaminated when referring to an individual with HIV or AIDS. And something to keep in mind when reporting on HIV transmission is to avoid the term high-risk group, as it implies the risk is contained within a group and therefore stigmatizes that particular group. If relevant, it's better to say people who engage in high-risk behaviors and then be specific about the behavior and the risk. If you have to discuss a group that has been disproportionately affected by HIV, you could say that the group is a key population vulnerable to HIV. And when speaking about prevention, there are two acronyms you should know, PrEP and PEP. PrEP stands for Pre-Exposure Prophylaxis, PrEP. This involves HIV-negative people taking a drug that will protect them against infection before potential exposure to the virus. Then you have PEP, which stands for Post-Exposure Prophylaxis, PEP. This involves taking antiretroviral drugs after a person may have been exposed to HIV in order to prevent infection. It's important to be aware of the language you use in your reporting, not only for accuracy's sake, but also to avoid stigmatizing words. And now that we've gone over which terms to use and which to avoid, let's talk about a few best practices to keep in mind when reporting on people with HIV and AIDS. As with any medical story, accuracy is critical, especially since important personal and policy decisions may be influenced by media reports. So you should double check all facts and figures to make sure they're correct and debunk any misconceptions. If you're unsure about something, then consult a medical professional who's up to date on the latest HIV and AIDS research. And in addition to speaking with researchers, caregivers, and policymakers for your story, make sure to also include the voices of people who have been diagnosed with HIV. It's important to get their perspective because they are being directly impacted by the virus. And when it comes to running a story that focuses on someone's HIV status, ask yourself the following questions before publishing. Does the story serve a public health purpose? Will this fairly and accurately depict people living with HIV? And does this story increase understanding and decrease stigma? If the answer is no, then you might want to reconsider running it. On the other hand, if someone's HIV status is not immediately relevant to a story, well, then there's really no need to mention it. Now, these are just some quick tips on covering HIV and AIDS. So for more in-depth resources, you can check out the NLGJA Style Guide and the GLAD Media Reference Guide. Again, I'm Dr. John Torres for NBCU Academy. Thanks for watching.